mystical experiences in the context of psychedelic experience?
Well, mystical experiences are a large part of the psychedelic experience in itself, so that's undeniable.
On the other hand, there's also a lot of discussion and critique about this concept, the way it's used in psychedelic research.
I personally don't have any objection against mystical experiences as a term.
I think mysticism is never neutral.
We shouldn't reduce therapeutic mechanisms to the mystical experience.
We maybe neglected other types of psychedelic experiences, which could also be linked to therapeutic effects.
The FDA-panel on MDMA-assisted psychotherapy.
It's just an advisory expert panel of the FDA, so it's not the actual vote. MDMA might not be approved in August, as was expected by most of the field, right?
I think there's a greater than 50-50 chance, substantially greater, that FDA will approve at that time.
Final call for boarding to Amsterdam, where I'm going for ICPR 2024, Europe's largest psychedelic conference. So there's one thing at the conference that everyone thinks about, but no one really talks about. And this is the FDA panel on MDMA-assisted psychotherapy that was a couple of days ago.
Breaking news is into us now. We're learning that an FDA panel has decided that MDMA is not effective in treating PTSD.
It really was a surprising decision, particularly given what we have heard over the years from many of the subjects who have described this drug and this therapy as a life-changing experience.
From what I understand, some of the concern was that the effect sizes were unrealistically large. So they couldn't quite believe that this has, that the blinding has been effective and that the placebo has been effective and so forth. And I think blinding is never perfect at all, but especially in psychedelic studies. It never is perfect because people know if they've gotten a psychedelic, and
it's pretty apparent.
It's pretty apparent, and the investigators or the therapists will also see that on them. So if you have the kind of, shall we say, pre-psychedelic, paradigmatic criteria to judge whether something is effective or not, then it's quite easy to make a case that psychedelics don't qualify. So a new paradigm comes with a demand for its own scientific rationality. So I'm not a friend of the idea that there is no exceptionalism with psychedelics. So basically, in order for something to be an effective double-blind procedure, you must not feel the effects of the drug you're taking. To me, that means the drug is either very slow in acting or it's very ineffective, right? So why would you settle for something like that? It's nonsensical. It's based on the old paradigm. At the same time, respecting the problem with lack of blindness and lack of placebo, because whenever you don't have proper experimental control, there may be alternative explanations. I am open to that, and so we need to be creative about this, not rigid, right?
Yeah, exactly. I think that was one of the problems the panel lifted, but also from my understanding, I think that there was lacking safety data and some concerns about therapist misconduct.
Yeah, and that part I agree with, actually. It's an area where ethical concerns need to be taken very, very seriously because people are in very vulnerable and suggestible states. So from a psychoanalytic point of view, it just invites a lot of transference and counter-transference. And so I'm not surprised that there are at least individual cases of sexual abuse, not necessarily abuse, but sexual relationships developing from these kinds of experiences. And if the field is not mature enough to kind of find ways of making sure that doesn't happen, then it may be wise to wait with this before our different countries are scaling up this kind of treatment.
This is just an advisory expert panel of the FDA, so it's not the actual vote, but very likely MDMA might not be approved in August, as was expected by most of the field, right? I mean, I think that's better that it happens beforehand than afterwards. I think while it's a shame that we have had to wait for so long, I think it's very important that all of the institutions are actually on board with the implementation of psychedelic therapies in a big way in the healthcare system. So I think that if there are still like oppositions and if there are still questions, then I think we as a research field should address those, and we should actually make sure that society is ready, right?
So moving along from the FDA panel to something whole different. Now we're going to talk about mysticism and mystical type experiences during psychedelic experiences.
Well, mystical experiences are a large part of the psychedelic experience in itself, so that's undeniable. The problem is a bit like you try to make science out of everything. It's a bit like making science out of art or making science out of theater. It's a personal, subjective experience. You can't really turn that into science.
Yeah, well, there's certainly a lot of studies that show that people have what could be called mystical experiences when they take psychedelics. Not all people, but a significant portion of people. And there's also dozens of studies by now that have linked the level or strength of mystical experience under psychedelics with later improvements in mental health well-being. I put some of them together in a review last year, and there was 44 studies, and 36 out of them found this sort of link in many different contexts and types of studies. So on one hand, there's a lot of evidence that such a link exists. On the other hand, there's also a lot of discussion and critique about this concept, the way it's used in psychedelic research. Are we really measuring reliably a reasonable thing that we can call mystical experiences? And about the fact that this is quite a historically particular term that has come to be used in psychedelic research that has a lot of problems. And what I pointed out in this talk as well is that because there's so much focus on the mystical type experiences, we've maybe neglected other types of psychedelic experiences which could also be linked to therapeutic effects, maybe as much or even more.
One way that I like to approach these questions is from a more William Jamesian understanding. This pragmatic approach. What do they mean for people? Mm-hmm. What do they do? What is the effect that they have? Are they turning people into more loving human beings? Are they experiencing improvements in their mental health and well-being?
I have cultivated my mind in the tradition of William James, and so when I use that term, and I know that that's the case for others who are using it as well, we really do not make any references to ontology whatsoever. So it's a phenomenological descriptor of what's going on in the mind of a person. So the label for that is mystical. But for people who are uncomfortable with that term because they think it's religious or implies religious ontology, it could be helpful to replace it maybe with transcendent experience.
It's a construct that comes from religious studies. It's fairly well suited, I think, to characterize a specific aspect of psychedelic experiences, but we shouldn't reduce therapeutic mechanisms to the mystical experience.
You're seeing some critique against the team at Johns Hopkins for two reasons. One of the reasons being that they use this construct, mystical type experiences, to explain what's the mechanism of action behind psychedelics. And the other critique being that they prime patients to feel mystical type experiences.
Right.
So in the context of that, do you see any issues with having this type of construct?
Yes. Yeah, I mean, in principle, I think it's a question of all research and of all questionnaires that we use. They make patients think about these constructs. They might be suggested something by these questionnaires. I think that's a matter with all questionnaires. Some research studies still, unfortunately, still only include the mystical experience questionnaire, and I would say it's probably better to more broadly assess change mechanisms that are also studied in conventional psychotherapy research, that are connected to psychotherapy research.
It's of course true that whatever we ask for, that's what we're going to get in terms of asking for people's experiences, and there are people who've said that even just asking about mystical experiences is priming people to have mystical experiences, and there is some sense to that. If that was just one part of a larger sort of repertoire of different kinds of things that we ask from people, then I don't think that would be such a problem. But if it's the only questionnaire about subjective experiences, then people will come to think, oh, this is what I should have been experiencing, because this is specifically what they're asking about. So there is some sense in that critique. The Johns Hopkins group has certainly been instrumental in sort of connecting the past research from the 60s and 70s to the modern day, and that's part of the reason why we are using a similar concept of mystical experience that was used back then. So in that sense, they are responsible for this fact, whether we like it or not. But they've done a great deal of really great work there. So I don't see. So yeah, it is good to think about this critically, but not to blame any particular group.
This is something that we're not very comfortable with in materialistic science in the postmodern world, while at the same time we know that they are responsible for a lot of the clinical efficacy of psychedelic therapy. But there is also an ethical complication, right? Because I think mysticism is never neutral. I think so you have to be very mindful as not to inculturate the patient into a new metaphysical or religious framework, which I think is ethically responsible in psychotherapy and in psychiatry.
We have, for good reason, to maintain a certain worldview neutrality, and we have gained that principle for good reason. It's about not using our own worldviews to try to change other people's worldview, which could easily otherwise happen in psychedelic states, because these are plastic states, so people are highly suggestible and so forth. But there is a dilemma, because you cannot provide a good set and setting if you just strip the environment and make it into a clean, white hospital room. And besides, white isn't necessarily neutral either. Right? So there's a dilemma. There's a real interesting dilemma operating there. And I think if we loosen a little bit of our neuroses about neutrality, we can provide more responsive and probably more effective interventions by not being so afraid of religious ideas, for example. But it's at the same time very important not to impose on those ideas on clients, but rather be responsive to them. Right. There was an interesting symposium also on psychedelic chaplaincy that raised these issues, and basically I think showed rather persuasively that there is no such thing as complete neutrality when it comes to these matters. So it's kind of a game we're playing to some extent, and if it undermines the clinical usefulness of it, it's a problem.
The moment people have these experiences, they need to make sense of them. And so as a chaplain, what I'm interested in is not giving my opinion, giving my worldview, but kind of taking a bottom-up approach, a client-centered approach. I think chaplains and religious professionals can also engage these questions at a deeper level. Mm-hmm. So it is through a collaborative, relational endeavor that we make meaning together, and we can offer some ways that insulate the client, or maybe also the field of psychedelic care, from bad epistemics, bad meaning making.
So if you speculate, I know it's hard now because there's a lot of things in there, and we don't even know what's going to happen in a couple of months with this MDMA treatment, right? But if you speculate, in 10 years, where do you see the field of psychedelic science?
Oh, I have different models, competing models. I need to choose one of them, or
choose an internal working model.
Choose an internal working model. Well, one reason why I'm a little bit enthusiastic and investing my time and interest in this field is that it has a lot of potential. So my wish scenario 10 years further down the line is that this kind of treatment will be generalized and applied in line with the universalistic logic of, say, the Nordic welfare state, so that it's not just treatment of treatment-resistant individuals with certain psychiatric diagnoses, but that it will start to be applied to volunteers in safe settings, also in other sorts of contexts. So I think that we find ourselves in a situation of cultural anomie. I've talked about that previously, or alienation, lack of connectedness, atomistic society, and psychedelics is one tool among others to kind of build a stronger sense of being in this boat together and not being acrimonious against one another, but actually building on a sense of cooperation and connectedness with everything, including nature. So those are my visions. They are very sober in the sense that I am quite aware of the the dangers of vulnerable people in hypersuggestive states. So this should not mean that I don't take the ethical issues seriously. To the contrary, I do. And so my alternative scenario is that this thing will just backfire because humans are fallible creatures and can't control themselves, and if that continues to be a problem, then the psychedelic renaissance will backfire probably.
The thing about the situation right now is that we've already completed quite a lot of trials, but there are more than 100 clinical trials running right now. So in 10 years, all, or at least the vast majority of these trials will be finished. So we will have dozens of clinical trials that have been completed about the use of psychedelics for many different indications. So I think we will have a fairly good picture about where and how the sort of model that we're using now is useful. What I would like to see is also the development of very different models of using psychedelics therapeutically. So almost all the current trials are using a similar idea of giving a dose of psychedelics and then directing people to an inner journey, maybe with a blindfold and music and so on. But maybe I would like to see also a return to this idea of a psycholytic therapy, so more of a traditional psychotherapy with relatively low doses of psychedelics, and also like active talk therapy during the sessions, and then integrating it into psychotherapy. That's what I would be really excited to see. Perhaps different branches develop during these next 10 years.
So if you just speculate, where do you think that this field is going in 10 years?
I think this will explode. I think psychedelic research is here to stay. And the great thing is you can always do research everywhere. We have problems with legality of using strong psychedelics, which is understandable. Some of these experiences can be very challenging. They're not for everybody, and you should not try psychedelics on your own. I highly recommend that to do it in a controlled setting. But I think if you eventually have a licensing system in Europe where you can go and have a very controlled experience and have support of professionals like nurses and others who take care for you, then I think a lot more people will be interested in having this experience for themselves. I'll give you a perfect example. We could really use psychedelics when it comes to couple therapy. We could probably have a far lower divorce rate and at least partners who understand each other during a divorce process if they could also be helped by, for example, MDMA. So research being done in these fields show very promising results. So I think psychedelic research is here to stay.
So I guess that's it for this video. If you liked it, please give it a thumbs up. It really helps us. And I'll see you in the next one.
Well, you got everything you want. You got me telephoning, lying on my bed, cigarette in